The problem is the dog's body can make antibodies to this synthetic antibody that's being injected. Every prescription medication comes with an insert that details potential risks and side effects. The problem is, most pet lovers never see that insert or are even informed of any potential risks before use. Whether you ultimately decide to use these medications, alternatives, or a combination of the two is your choice to make. The goal of this video is not to spread fear, but to educate and empower pet parents so you can ask informed questions and make the best decisions for your own pet. So today we're going to talk about Cytopoint, which is another allergy drug. There are so many of these allergy drugs because allergies are the #1 problem that animals are presented to the veterinarian for. Veterinarians are always looking for a way to solve the issue for your pet. This is another drug that is licensed for use in dogs only. I don't think this one's been used in cats yet because it is a canine-specific monoclonal antibody. So it's made for dogs. And I think that cats would have a lot of reactions to it. It was brought to market in 2016 in this country, 2017, I believe, in Europe. I saw something on their website that said it's been used in over 5 million dogs, and I'm sure that's an old number, so it's gone way up. So it blocks interleukin 31. So this is the chemically part. Interleukin 31 is a cytokine that triggers cell-mediated immunity against pathogens, and it basically blocks the interleukin 31 from binding to its receptors. It works only 60 to 70% of the time to decrease the itch. And interestingly, in their literature, which really hard to even find information on this, I'm going to do a shout out to Jane Lister, who found the European EMA medical adverse event reports for me for 2017 and 2019, I believe. Sent them to me this morning. I tried to find them on the FDA website, and Cytopoint does not even come up. And when you go to the Cytopoint website, which is part of Zoetis, it takes you to, and when you click on drug insert for Cytopoint, it takes you to the drug insert for Apoquel, because they recommend using both of these together. Talk about a double whammy. Let's just destroy everything. Doesn't look bad when you look at the package insert. That's exactly right, because all they do is tell you how to use it, what the dosages are. There is no usually on the drug insert, when you can find it, it will have the post-distribution adverse events. So they have the study events that led up to it, and every study that I found was sponsored by Zoetis. Let's see, is it going to be skewed toward it's a wonderful drug? Yes, it is. Could not find studies I went to PubMed, I went to a lot of the different scientific websites, and could not find anything produced by an outside independent party studying this drug. So that's a little scary to me when you're only hearing things from one point of view. So not only does this target that one part of the immune system, it basically dysregulates the entire immune system. So they like to have you think that this is not going to be an immunosuppressant, not going to shut down the immune system. It dysregulates the entire immune system, and yes, it does cause problems, the same as we see with a lot of these other drugs. So minor reactions, injection site pain, and swelling. You can get that with any injection, and some animals are more stoic than others, so some of them don't really react and others react a lot. The problem with this is that this is a monoclonal antibody. When we inject this into the dogs, they may respond, and if they respond, they're going to respond within 1 day. The drug can last anywhere from 4 to 8 weeks. It's recommended and labeled as a once-a-month injection. Now, if it happens to last in your particular animal for 7 weeks, why would you go back in 4 weeks and give more than you need? And it says on the drug, the little bit of drug insert on the dosing applications, it says if they don't respond to the first injection, go ahead and give another one a month later, because maybe they'll respond to that one. Okay, so we get 2 tries, at least. By the way, for a lot of dermatologists, even if it's not working, they have you keep coming every month and giving something that's not working. It's just a waste of your money. The problem is the dog's body can make antibodies to this synthetic antibody that's being injected. For a lot of animals, it'll work the first time, and then it might work the second time, but by the third time, they've made antibodies to it, so now it's not working. So if you've been getting it, and you got a great response once or twice, and then you're not getting the same response anymore, quit using it, because they're making antibodies to it, and you're just flushing money down the toilet. Side effects: itching, dermatitis, ear infections, skin infections, red skin, and hair loss. Perfect. Isn't that what we're trying to get rid of? Vomiting, diarrhea, lethargy, anorexia, behavior changes, and hyperexcitability, because this does cause neurologic disorders. Hyperthermia, which is an elevated body temperature for no good reason. Urinary incontinence. Immune suppression and autoimmune disease, including autoimmune hemolytic anemia and immune-mediated thrombocytopenia. Seizures, convulsions, ataxia. Liver damage, clotting disorders. Anaphylactic reactions and shock with facial swelling and hives. Cannot be used in dogs under 8 pounds, breeding or pregnant dogs. And the European post-market reports are showing immune-mediated hemolytic anemia and immune-mediated thrombocytopenia, respiratory tract disorders, neurologic disorders, blood and lymphatic disorders, and blindness. Perfect! Just what we need. Now, they say that these side effects are rare to very rare, which means they're anywhere from 1 to 10 dogs per 10,000 injections given. Again, if I happen to have the one dog, that's 100% for me. They're saying 5 million dogs have been, I didn't do the math on this, but if 5 million dogs have been injected and 1 in 10,000 or 10 in 10,000 have a reaction, that's a lot. It's really a lot. Somebody can do that math. This is a huge issue. And again, we're not solving the problem. You're putting a Band-Aid on the itching symptoms. So this is a common thread that we've seen with steroids, cyclosporin or Atopica, Apoquel, Cytopoint. All these drugs are trying to decrease symptoms. They are not curing the underlying problem. Now, we do have incurable atopic dermatitis. We have a great blog on that. It's been posted pretty much every day under these drugs, and I'm sure somebody can post it again. And then we have another blog that says you cannot fix allergies unless you fix the diet. Not only do you have to fix the diet, you have to fix the gut microbiome. And I'd recommend that you go back and read the blog on incurable atopic dermatitis, because that's the environmental allergies. That's not the food allergies. And it has a lot to do with what your dog was fed, particularly as a youngster, what your dog's parents were fed, and if your dog's parents had allergies. And I know a lot of us do rescue work, so we have no idea what the background is on these guys. But if you're buying from a breeder, I suggest strongly that you ask that breeder, hey, any parents got any allergies to anything, food intolerances to anything? What have you been feeding them? Are they kibble fed? Are they raw fed? How many vaccines have they had? How many vaccines are you giving these puppies? We want to start off on a good foot with these kids, but some of them we do have issues in the background that has been passed down to them, unfortunately. There are certain breeds of dogs, and I'm going to go with the bully breeds because those are the ones that had the most trouble in my practice. French bulldogs, top of the list. American bulldogs, especially if they're white, top of the list. White pit bulls, top of the list. English bulldogs, top of the list. These guys are walking allergies looking for a place to happen. I have never gotten one to do well on a kibble-based product. They don't do well with anything synthetic in their diet, so don't use synthetic vitamins and minerals and supplements. These guys need real whole foods. They usually need a nice cooling diet. They need a very simple diet. And we highly recommend raw. I have cured so many of these animals just by fixing their gut microbiome, treating them for their leaky gut, and getting them on a cooling, draining diet from a tcvm perspective. Sometimes we add herbs into that. So we've got external wind or great wind keeper. That particular herb, I believe we have one of those on our website. If you have a dog with seasonal allergies, starting them the week before you know their allergies are going to pop up, getting them started on an herbal formula right before their season occurs, having them on that cooling diet, preempting things if you've got seasonal problems. A lot of dogs, that's all they need. All they need is that seasonal treatment with natural products. Dr. Rita Hogan, she's an herbalist out on the West Coast. She was a speaker at the Redefining Health Expo. She's amazing. If you want help with herbs, I would strongly recommend a consultation with Rita Hogan. She's amazing. She said that her favorite thing is nettles as far as herbs for dogs with allergies. There's a lot of things out there that you can try. The PEA is a great anti-inflammatory. CBD oil is a great anti-inflammatory. Omega-3 fatty acids. So whether you're using fish oil, phytoplankton, algae oil, getting high doses of omega-3s and getting the diet as clean as possible. Because I'm just going to tell you, if your dog spends, or cat, spends years on these drugs, steroids, Apoquel, Cytopoint, Atopica, you're going to end up with cancers. You're going to end up with immune dysfunction. You're going to end up with super infections. And then you're going to throw antibiotics on top of that. And you're going to end up with things that are so resistant to the antibiotics. I get emails almost daily from people. My dog's been on antibiotics off and on for a year, 2 years, and now we're down to it's resistant to everything. We see the same thing in people. We're overusing antibiotics, we're overusing immune suppressants, and we're not getting to the bottom of what is causing the problems for these animals. It does require a lot of work. I know it is frustrating. I am not berating or telling anybody they're wrong if you've been using these drugs because you can't stand seeing your dog bloody red, itchy, keeping you up all night. It's a miserable way to live. Really miserable. The number one allergy is flea allergic dermatitis. One flea bite sets them off. Stewie, horrible flea bite allergy. One flea bite, that boy's going to be a mess. He's kind of my sentinel. Like if Stewie is ripping himself apart, then I better be looking for fleas on every single animal in the house. Flea bite allergy, this is where the veterinarians then turn to the first chemicals we talked about, the neurotoxins to kill fleas and ticks. You've got to go more natural routes for that as well. Every time we put a toxin into their system, so whether it's an antibiotic, an immune suppressant, or a flea and tick chemical, we are dysregulating the immune system and we are causing dysbiosis in the microbiome on and in the body. And all of that is critical for good health. And if you have an animal who's had allergies for 5 years, it has been on immune suppressants for 3 or 4 years, it's going to take you at least that long to get them turned back around. This is not an overnight fix. This is not, oh good, I'll switch him to a raw rabbit diet and tomorrow he'll be off all his meds and he'll be good to go. It doesn't work that way. This takes a long time because you have so much dysbiosis, so much leaky gut, so many bad things going on in the body from years of basically abuse, not on your part, but that the drugs have caused to the body. So it's really critical. And you really can't just say, okay, I'm just going to stop all the drugs today. Some of these drugs have to be weaned. Some of them you're going to get a horrible rebound effect if you just stop. Well, first of all, you can't stop cold turkey if you've been on long-term steroids because their adrenal glands have been shut down. You'll get an Addisonian crisis. If they've been on these other drugs, like the Apoquel and the Atopica, if you stop, you may get a rebound effect the next day or within the first week, and they'll just be tearing themselves apart. And then you're going to say, this doesn't work, and you're going to go right back to using it. Somebody emailed me today that they were going to their holistic vet who was recommending Cytopoint, and meanwhile, we've got flea allergy going on. You got to get rid of the fleas. That's the answer to the problem, not destroying the immune system. So we got to even out the immune system. I saw something as of 2017, Zoetis was making $5.3 billion a year. That was 5 years ago. So, now we've added a bunch of more things onto their list. So horrible. Okay. I get a million things to do. I'm going to go outside for a few minutes. I've been sitting at my computer all day.